Hi guys, this is Victor. Welcome to White Coat Chronicles. I'm here with Endee from Nigeria. So Endee, tell us who Endee is and why we are here today.
All right. Thank you very much for this great opportunity.
Okay.
My name is Nnamdi Peter Iboluchi. I'm a student nurse, a graphic designer, a video editor, and a content creator.
Awesome.
Yeah. So today's topic, liver cirrhosis. This is just like literally, I'm tired of the liver saying that I'm tired of your nonsense.
Yes.
Okay.
Okay. All right. When you say, when your liver says I quit, it means that, I quit business, right?
Yeah.
So Endee, break it down to us. What exactly can you make the people know? How can the people understand what liver cirrhosis is?
All right. Liver cirrhosis is a chronic condition where liver cells or liver tissues are being replaced by scar tissues.
Okay.
And of course, you know that the liver plays a vital role in the human body. And up to now, I feel like the work of the liver is underrated.
Very underrated.
Yeah, the liver does a lot of function. Imagine when you eat a meal that contains some toxic substances, and the liver does the job of detoxifying the substances. So just imagine when your liver is being cirrhosed. Just imagine when your liver is being scarred. It cannot detoxify this substance, meaning that literally your bloodstream will be full of toxicants. And also the liver also play a vital role in synthesis of protein like albumin and also blood clotting factors like prothrombin, fibrinogen. So literally when someone has an injury, the proteins, the clotting factors that are being synthesized can regulate this blood clot. And also the liver helps in storing and releasing energy or glucose when needed. So imagine when the liver has been cirrhosis, it cannot literally perform all this function or this vital function it does in the body. And to be honest, the first time I worked in the clinicals, I met a patient that has a liver cirrhosis. We lost the patient. So it's a very chronic condition that needs to be properly checked.
Yeah, a lot of people kind of, don't see it or experience it because of how slow the symptoms build.
Of course.
Understanding how liver cirrhosis functions and what it does, it's something that we have to yearly, go through our body systems, every organ, try to check, do blood works and stuff like that, just to be able to experience this, to see the symptoms and know what it's like, and get yourself ready, for what is coming,
Yes.
Yeah. So basically what you're trying to, what we just broke down is the liver becomes a construction site, but in this construction site, there will be no workers.
Yes.
As a result of the liver dying.
Exactly.
Okay. Talking about symptoms, we just went talking about symptoms right now. People have to do tests just to, because most times we don't see the symptoms, right?
Yes.
We don't see the symptoms. So now, what symptoms do you think the people have to be aware of? Like when you see this, when you experience this, it might be liver, but, go see your doctor. But make us understand, what symptoms do people experience? And we can say, okay, this is what it is. I need to see the doctor immediately, or watch it. Go ahead, tell us.
Okay, in every disease condition, we have the signs and symptoms.
Good.
The signs is literally what someone can observe, either by a nurse or by a layman.
Yes.
While the symptoms is basically what the patient can tell you. So, of course, the cardinal sign of liver cirrhosis is jaundice. And it has to do with yellowing of the eyes, the skin, the mucous membrane. So with fatigue, they'll be feeling tired, they'll be confused, and nosebleeds can occur.
Yeah.
Or easy breathing. So I'm going to be in particular with the yellowing of the skin. That has to do with jaundice. Because once the red blood cells are being destroyed, one of the products that is being released is bilirubin. And this bilirubin will get to the liver. And what the liver does is that it excretes that bilirubin into bile or through bile. But once the liver is cirrhosed, that bilirubin cannot properly be excreted into bile. So it becomes excess in the bloodstream. And bilirubin is just like something yellowish or something, but that's the substance that makes the person's skin to appear yellow. The eyes will become yellow. The mucous membrane also appear yellow due to excess secretion of this bilirubin into the bloodstream. But remember, it was meant to be excreted in bile.
Sure.
But the liver is now cirrhosis. It cannot. Just see the liver cirrhosis as a condition whereby if your liver is meant to do something, it can't do it again.
Yes.
So all part of the liver is being destroyed.
Being destroyed. It is so beautiful how you were able to break this down. And I hope you guys out there are taking notes, because once we as humans begin to look after ourselves, these things he just explained, these things we medical people see, and when we talk to you guys, it feels like we're speaking in tongues. When we talk to you guys, it feels like we're speaking in tongues.
Yeah.
These things we see, you can understand them as a layman if we try to equip ourselves with knowledge about these things. Sometimes it can be hard because of the medical terms. We get it. Nurses, I call them intermediates between medicine and healthy living, because we do the connections. We connect things, and connecting things means coming down to people's level.
Yes.
So yes, these things he explained, I hope you guys are taking notes, because somehow, somewhere, somebody is experiencing this.
Yeah.
Somebody is seeing this. Trust me, it's not a skin condition. It's not something that your village people are doing. It's not something that, this is happening because of this.
Yeah.
Please go get yourself checked out. Please go see your doctor. Please go talk to somebody who is enlightened like this, who has this knowledge, and see how help can come. So now, treatments are of diverse ways. We understand, there's a way you can treat a disease or an issue, medical issue, aggressively, or you can be a little bit non-aggressive, to like backpedaling on the treatment.
Yeah.
But what would you make these people understand? How would the people out there get to know that when you are undergoing treatment for something, it doesn't mean it's the end of the world. It's a way of, helping you. You don't need to be frightened. You don't need to be scared about it. It might sound like a difficult treatment. It might sound some way. So what treatments do people out there with liver cirrhosis, or people who are out there experiencing this liver cirrhosis, this treatment, how do they get to understand it? When your doctor comes in and say, hey, you have to be treated with this, bam, they are lost. They are like, oh, that's the end of the world, because of the terms he used. So these treatments, what are these treatments, and how would the people, be able to understand this treatment and see that it's not something harmful?
Okay. Like you rightly said, you are from the US, and of course you have the normal treatment of this kind of condition.
Okay.
People do go for transplant.
Yeah.
People can be on antiviral medications. Let's say if the cirrhosis is caused by hepatitis, that's a viral condition. Mm-hmm. So for the transplant, yes, the liver transplant can be done. A lot of people don't know that we can do liver transplant.
True.
Just like we can do kidney transplant. So, but the only problem there is that if the resources is there, there is a medical intervention that can be done. The liver transplant, being on antiviral medication if the disease is caused by the virus.
Yes.
So the only problem is just the resources, but there is the treatment that can be done for that.
Okay. So you hit a note right there talking about people, not understanding that there could be liver transplant, and comparing the United States and how treatments are being done in Nigeria. We just have to understand that when you need to be treated for something, you need to be treated for it. Do not deny yourself the opportunity to feel healthy just because you don't understand it. Also, to the part you talked about, if the liver cirrhosis could be caused by hepatitis, So now, drawing from that, it's a little bit deviation from the topic, from the liver cirrhosis, even still under the same umbrella.
Yeah.
You mentioned hepatitis. Let's take hepatitis B, for instance. That means people can have liver cirrhosis, maybe not through drinking, maybe not through, liver malfunction as a result of chemical changes, but it could be maybe from STIs, right?
Yes. Of course.
So we just have to watch out for that as well. Watch out for STIs.
Yes.
And go ahead, tell us.
A lot of people do tag liver cirrhosis as being caused by alcohol.
Yeah.
Yes, alcohol can cause liver cirrhosis. Mm-hmm. And the worst is when you take this alcohol together with paracetamol. Oh. So there are other things that can cause this liver cirrhosis. Mm-hmm. When there is a viral infection in the body, it begins to attack the liver cells. And as the liver is trying to regenerate, if the liver is trying to correct that destruction or whatever, it becomes replaced with scar tissues.
Yes.
Just imagine when you have a cut in your hand. When there is a cut, a bruise in your hand, there will be scars or keloids in that area when the wound has healed. Just imagine your liver that way. when it has repaired something, and after the repair, it becomes replaced with a scar tissue. So when this continues to happen often, your liver will be completely covered with scar tissues, and that literally affects the work. So it's not only caused by alcohol, it can cause by viral infections, sexually transmitted infections, and so many more.
I like the way he breaks his analogy,
Thank
I
you
like
very
the way
much.
he makes you see the picture, of which that's what nurses do. That's what we do. When we talk to our patients, we try to make them picture this and see the seriousness behind it and see why this should be this. Okay, now, Andy, can we, give a little bit advice to the people out there? What would you advise the people out there when it comes to liver cirrhosis? Let's hear it.
I'm going to be more specific, but it can happen to anybody. It's
True.
just for the men, for people that take alcohol. Alcohol is, I don't take alcohol.
Okay.
So alcohol is something that a lot of men do take, and they feel like it's a pleasure or whatever. If you want to take alcohol, you can take it, but let it not be too much. Just have it in mind that alcohol is toxic to your body, just like ferrous medications.
Yes.
And the worst, like I said, if you take this alcohol with paracetamol, you are kind of doubling that toxicity.
Yeah.
So taking alcohol being toxic, alcohol is a toxic substance. When it gets to the liver will detoxify it. And once the liver detoxify it, it's just like any form of detoxification brings about the death of hepatocyte,
Yes.
that is liver cells. So when this continues to happen often, your liver will be completely scarred. So that is it. That's for the men. You have to reduce the way you take alcohol. I don't say you shouldn't take alcohol, but just reduce the excessive intake of alcohol, because that is the major cause of liver cirrhosis. Like I said, I saw a patient. The first time I worked on clinic, I met a patient that had liver cirrhosis, and he's a man, and it's due to alcohol intake.
Excessive
So
alcohol intake.
yes, if we can reduce the way we take alcohol, that will bring a long way. That will help us a lot.
Okay. And adding to that, he mentioned the medication. What was the medication you say?
An antiviral medication.
No. The one you mentioned, the pain pill medication. Did you say paracetamol?
Yes.
Okay,
Analgesic,
paracetamol.
yeah.
Now, I guess that's for Nigeria. In the United States, we take acetaminophen, which is Tylenol. It helps, like it makes the liver work a lot more too, because it's like tough. I think you should take about 3,000 mg a day. You should take about 3,000 milligram a day of Tylenol. So it's a wrap. Endee, thank you for being with us today. And I believe the people out there has come to understand that liver cirrhosis is deadly. It's a slow poison. You might not see it coming, but it's there. Adding to his advice, I would advise every single one of us out there, periodically go for your lab check, your lab work, do your CBCs, complete blood count, do your CMPs, comprehensive metabolic panel, go ahead, do your BMPs. Just check your body top to bottom.
Watch out for the signs.
Yes, watch out for the signs so that you would not be left behind when it hits the fan. All right, guys, it's a wrap for today. We'll see you on the next episode of White Coat Chronicles. And Endee, thank you for being with us today.
You're welcome.
See you guys. Thank you.